All right, well, thank you all for joining us. We have, it looks like 78 attendees and 12 panelists for this conversation today. I thought I'd do a quick introduction. My name is Roland Lammy. I'm the Executive Director of the New Hampshire Community Behavioral Health Association. I want to thank you for joining us this morning for an important conversation with some great panelists around mental health during the COVID-19 crisis. Today we'll be discussing several of the great strides that have been made by our community mental health centers, our provider network, to handle the needs of our communities and our clients. And you'll hear different perspectives about all the challenges that even all of us have faced during this crisis and during this emergency order. Just really quickly, I thought I would mention, I've been working with the community mental health centers for over 18 years. I've watched them scratch their way to success in the face of adversity on so many different issues, from the beginning when we had legislative inquiries on financial management, throughout our time and in the recession dealing with dwindling economic resources. We've stood up issues and requirements in the community mental health agreement. We've implemented managed care and turned our financial shops inside and out. We've dealt with SIM activities, IDN activities, hub activities, all the while having workforce challenges and constraints. And we've had the varying perspectives of 6 commissioners and 5 governors throughout that 18 years. But as I stand here today, getting ready to hear this great panel, I've never been more proud of the work that the community mental health centers have done in the face of this crisis. As we continue to work during the emergency order to stand up services, make sure we're meeting client needs. I couldn't be more proud of the work they've done. They've really shined in the face of adversity, and I'm very proud to be working with them. So with that, I want to turn it over to our moderator, Anne Marie Timmons. Anne Marie is an associate for legal assistance and on the board of directors for Riverbend Community Mental Health. She's been a tireless advocate for mental health and mental health resources. And I know that she will be a wonderful asset to kind of lead this conversation and get the different perspectives from several of our great panelists. So thank you all. And I hope you enjoy this. Anne Marie, it's all yours. I appreciate it.
Thank you, Roland. Again, welcome. I'd like to welcome everyone as well. In a moment, I'm going to go around the virtual table and ask our panelists to introduce themselves and sort of where they're from so you can get a sense of who's with us today. First, some just housekeeping topics. This is a virtual panel meeting. Please bear with us if we have technology problems. I think we're all learning this new reality together. We will take your questions. We welcome your questions. So if you could all look on your screen, you'll see a Q&A at the bottom of your screen. If you could submit questions that way rather than chat, we will be able to keep track of them much better. We will, and if I should say, if I look distracted while this is going on today, it's because I'm trying to monitor questions and make sure we're not missing any. We will have 2 interpreters today. They were working as a team, so one of them at a time. And I should just let you know that this is being recorded, just so we can make it available for those who couldn't join us today. So with that said, I am going to go around the panel here. I guess start with Erin. Could you introduce yourself and tell us where you're from?
Sure. Thanks, Anne-Marie. I'm Erin Farrell. I head up the Adult Services Department for Community Partners. We are the Community Mental Health Center serving Stratford County. And basically, my programs are there to help people who have severe and persistent mental illness, adults with severe and persistent mental illness. So we have our therapists, case managers, functional support specialists. We also have an acute team that handles more challenging cases. That's the Assertive Community Treatment Team, our ACT team. And I believe all community mental health centers throughout the state have that. So that's just a rough overview of what I do.
Could we move to Jessica now?
Hi, I'm Jessica LaChance. I'm the director of the Mobile Crisis Response Team with the Mental Health Center of Greater Manchester. We are the largest community mental health center in the state, serving the Manchester region. We serve over 11,000 people per year. We have over 400 employees. And the Mobile Crisis Response Team has been in operation since 2016. And basically what we do is we provide community-based crisis assessment and interventions for people in our community who are experiencing a mental health and substance misuse crisis. We have a 24/7, 365-day-a-year team. And our primary role is to go out into the community and work with people wherever they are at and help them work through a crisis.
Thank you. Jody, could you introduce yourself?
Yeah, thank you, Anne Marie. Hi, my name is Jody Labarsky. I'm the Child, Adolescent, and Family Services Director at Seacoast Mental Health Center. And very similar to what Jessica and Aaron shared, we are the community mental health center serving the eastern half of Rockingham County. The Child, Adolescent, and Family Services Department works with children, their families, their caregivers to support their mental health needs. Our staff do this either in the office, in the home, or in community-based co-located services. So within our region, we have staff in over 25 schools within our region and 6 pediatric offices where we provide care and supports. And then we have an adult services team. And then my colleague Dennis will in a bit talk about our emergency services supports.
Thank you, Jody. Michelle, can't see you, but I know you're here. Could you introduce yourself? Is it possible Michelle is on mute?
All right, I'm off to a great start. I'm Michelle Myler from the New Hampshire Department of Education's Bureau of Student Wellness. We work to support schools and communities working together to create comprehensive systems to support the whole child by providing technical assistance, training, and resources through federal and state funding and our framework called Multi-Tiered System of Support for Behavioral Health and Wellness.
Thank you. Ken, are you there? Could you introduce yourself? Ken may be on mute. Let's see. We'll connect with him offline. Dennis, could you introduce yourself?
Sure, thanks, Anne Marie. Dennis Walker, Seacoast Mental Health Center. I'm the Emergency Services Director. We're primarily responsible at the center for crisis assessment, intervention, and stabilization. We're a 24/7 program. We staff both of our centers in Exeter and Portsmouth through open hours, and we're also embedded at the Exeter Hospital 24/7.
Thank you. Is Ken back with us? Okay. How about Cynthia? Could you introduce yourself?
Sure. My name is Cynthia Whitaker. I am the Chief of Services at Greater Nashua Mental Health Center. So we have all of the same services that the others from the other mental health centers have mentioned. And in my role, I oversee all of those different clinical departments throughout the agency.
Okay, thank you. I'm hoping we've reconnected with Ken Norton.
Hi, Ken Norton. I'm the Executive Director of NAMI New Hampshire, the National Alliance on Mental Illness. And we're a statewide grassroots organization. We're not treatment providers per se. Our mission is to improve the lives of all people impacted by mental illness and suicide. And we do that through support, education, and advocacy.
Thank you, Ken. I think that is everyone. I'm going to now move through each panelist, and we're going to start with a question for each of them. within their focus area. And again, if you want to submit a question, please do through the Q&A, and we'll try to get to those as many of those as we can. So Cynthia, if we could start with you. I think you, like everyone on the panel, has had to move much of your, many of your services online. And I know it was a heavy lift. It's been impressive to me how smoothly that's happening. I do my counseling that way now, and it's not the same, but I'm so grateful to have that opportunity. Could you tell us a little bit about just how did your staff approach this? Was there hesitation, nervousness, and how did you get through that?
Sure. The first answer is, of course, there was hesitation and nervousness, right? We had to basically change all of our operations, within a week to week and a half's time. But what I would say to that is that because one of the strengths of community mental health centers is our team structure, that even through our nervousness or our worry, because we have such a supportive team, that folks just rallied together and helped one another. So, as an example, right, most of our community mental health centers run with multidisciplinary teams. So we have psychiatrists, therapists, case managers, community support staff, supported employment, health mentors, all working together as a team to support clients. And so as we're shifting all of these services to telehealth, and people are starting to, how are we going to do this? How are we going to do this? We were able to use that connection and that teamwork to share what was working, to share the creativity, to share the innovation. So one staff, was able to use Google Docs to do a resume building with a client through supported employment services. And so boom, then that innovation gets spread across the agency and other people are able to adapt to it, or using music over the telehealth with kids to get them engaged. And so sharing those innovations and sharing the stories of success throughout our team really helped calm the nervousness that folks were feeling.
And are there aspects of your work that you're still trying to move online, that you're in process with that?
No, we really moved everything online already. The last thing to come online was our group therapy for us here at Greater Nashua Mental Health Center. It certainly was, the hardest to figure out how many people can you see in the Hollywood squares like we have right now. And, teaching the clinicians to interact differently. It uses different energy to manage a group of people online in telehealth than it does in person. But at this point, basically all of our services, except for some that are, our emergency services and some ACT level services, or some services that need to just be done in the community with clients one-on-one, we to shift completely to telephone or video.
Thank you. Jody, if I could turn to you. With your work at Seacoast Mental Health Center, you're providing services to adults and children, and you, like everyone, have had to move that online. And I remember from my work as a guidance counselor, school counselor, I really wanted to have eyes on my students to pick up all those nonverbal cues, and I'm guessing that's been a challenge for everybody. So how have you transitioned? How's that gone for your clients? And what have been some of the biggest concerns, but also some of the successes and surprises?
Sure. I think for, very similar to what Cynthia commented about, our agency was very swift in moving to a remote environment in order to provide safety to our patients and our staff here at the center. And we did it so quickly, and it honestly felt very seamless, the process, as far as making sure staff had the necessary technology so they could continue to connect with those patients that they were working with. I think many of us, the biggest concern we had was whether or not the families or the patients we were working with would have the technology necessary in order to connect, whether or not they would have the willingness to connect as well, because it certainly different than being in an office face-to-face versus being on a video screen or through telephone. I think we've had a small percentage of folks who don't feel comfortable with the video conferencing for their sessions. And so we've been able to adapt and either use telephone. There's a small percentage of folks that are coming into the office. So I think that was the initial concern. I think when you start to think about from a treatment perspective, would we be able to continue treatment in the same manner as we were in person? So I think of some of our staff here at the center who are trained in child-parent psychotherapy or doing attachment-based family therapy. Would we be able to continue that same very sensitive but robust treatment through telehealth? And I think the surprises have been that yes, for the most part, we've been able to do that. I see a small caseload of folks still at the center as well and had some of those concerns, and it has felt very seamless as far as how we've continued to address the treatment goals and objectives of the young people we're serving here at the center. Then what's been really incredible is to watch how creative staff have gotten with this. We have staff who are trained in another evidence-based practice known as MATCH, which is a modular approach to treating children and families. It addresses depression, anxiety, trauma, and compliance issues. So as an example, one of our staff was using the anxiety protocol to work with a young person, and to work through some of their anxiety, they brought up the virtual environment of Disney World and rode rides together to do some exposure work around this young person's anxiety. And so where we really kind of went into this thinking, and I'm looking at our Hollywood squares, and most of us were probably trained not to do therapy in a virtual environment. We were trained to do it face-to-face, to see the really creative nature that our staff have been able to use technology. The kids love it, so we've really just used their desire and their interest in technology to, I think, just continue to help them thrive and address those treatment goals that they were doing in person and now in a telehealth world instead.
Thank you. I love that example. Just to touch on something you mentioned, some clients are still coming in. How are you handling social distancing so there's safety for staff, but also for the client?
So we have a very, very small percentage of folks who come in. This is probably mostly related either to those situations that Dennis will talk about related to emergency services and psychiatry. But when you walk up our front steps, you'll see the yellow markers that indicate 6 feet of distance. So if we have more than one person coming in, that we're able to create that spacing. We're following all the CDC recommendations. So our staff and patients are asked to wear a mask in the building. We're doing a screening for COVID symptoms when anybody enters, again, both staff and patients. And we do a temperature check as well. So then, probably what many of us are already starting to explore and do is what it will look like when we all return to the office. So at our center, we've been spending a significant amount of time talking about our office spaces, probably doing a little Marie Kondo work for a lot of us to declutter our offices so we can create more 6 feet of space in them. As much as many of us have created this very personalized nature within our offices, taking out the tchotchkes, removing some of the extra lamps and furniture that we've brought in so we can continue to promote safety for our patients and our staff as we move to going back to the normal that we were more accustomed to prior to this.
Thank you. Erin, if I could turn to you, I'm sure you're experiencing a lot of these same challenges and maybe surprises as well. I know at Riverbend, we had been planning and talking about moving to telehealth for some time. This forced us to do it much more quickly than we expected, but I think there's been similarly a lot of success stories, and the staff has been really creative. Could you talk a little bit about the progress your clients are making? Are you still seeing progress as clients have moved to this telehealth setting?
Absolutely. I mean, just like Cynthia and Jody have said, we had to move very quickly to telehealth, which was a big adjustment for staff and also a really big adjustment for clients. Many of the clients that we work with in my department don't necessarily adapt to change very well. It's really hard to change. And they actually adapted very, very quickly. I think we still have a small number of clients who really do not want to meet with us remotely in any way, but the vast majority are willing to do telephone or video services, which has been really great. I would agree with everything Jody said. The staff are just so creative with what they're doing in their remote sessions with clients. I think I will say that the child and adolescent crew, I think you've got a leg up on the adult services crew in terms of technology. I think a lot of kids and families have more access, and that is the result of remote learning. I think they're also just more comfortable with it. So one of the bigger challenges we faced with adults is trying to help them both access technology, but then to get it a little bit more comfortable using it as well. And so the vast majority of our remote services right now in the adult world is still being done telephonically. We are not doing a ton of video. I'd say it's about 80-20. But for those who are able to use video, you know, we've therapists who are meeting with their clients and they're able to use the share screen function via Zoom to share DBT handouts, for example, for clients who are in that track, or illness management and recovery handouts. Those are some of the evidence-based practices that we use with our clients. And people are really making progress. It's been tremendous to see. So, and I think as much as the shift went really well for the staff and for the clients, I think I want to definitely give some kudos to our IT department for helping to make sure that all of those transitions happened, because it was a really heavy lift for them as well. But right now, everything we're doing is remote. We have some clients, very few that we see, primarily our clients on the ACT team, the Assertive Community Treatment team. We do see face-to-face because their needs are really high, and that's the best way that we can do it. We also have continued to provide an injection clinic. So we do have clients coming to our office to receive injections every week. But all of those are very carefully spaced out. There's never more than one person at any one time. We've insisted people, of course, get temperatures taken and or they're wearing masks. And we've even provided transportation using one of our agency vehicles for people, so that we are able to provide the distance that's recommended between the driver, who's one of our staff, and the client, who's in the back of a minivan, and everybody using PPE and one client at a time and sanitizing in between. So we're trying to even make clients coming in for their injections as safe as we possibly can. So I think we've done a lot of things to adapt, and it's been great to see that clients are still able to get their needs met and to make progress in therapy and with FSS.
Great. Just a follow-up question. You had said for your adult population, it's about an 80-20% split with the majority over the phone. How are you checking in just to, you're not having eyes on a client? So how do you check in? Is that approach different than it would be in person, different questions or?
It is. You know, we therapists really like to have eyes on because nonverbals are very important. And I think our therapists have learned to ask some different questions, and some of them are much more direct and pointed. You know, did you take a shower today? Are you dressed in clean clothes today? Or, you know, really, because I can't see you. So I'm going to ask these questions. And I think that that's probably the biggest change. But for the most part, we're really still focusing on the treatment goals and, of course, the increased stress that most people are experiencing as a result of the pandemic.
Thank you. Michelle, if I could turn to you. Like everyone, this has made your world upside down too, I'm sure. You're not providing direct service in the same way that the other panelists are, but you're really a resource for children, for families, for schools. And I know there's got to be some challenges there as we've shifted to remote learning. And then as we move to the summer and thinking about having technology be the connection maybe for families. I know in the Manchester School District, they've loaned out 3,700 devices for students who don't have them. And so the conversation with the mental health center now is, do we let them keep those over the summer because telehealth has really moved in that direction? So what are you seeing on your And how are you checking in with families and students? And sort of, could you give us some sense across the state what you're noticing in terms of what challenges, but also how that they've responded to those?
Sure. So yes, it is true that we support schools and communities working together, not so much the direct service, but really to help schools and districts and communities working together to respond to the current environment. So this is obviously a new current environment. However, we always plan we really see ourselves as being a technical assistance hub that provides training, resources, in response to the data in New Hampshire. For example, we have prioritized for many years now training such as suicide prevention based on New Hampshire data, demonstrating the risk factors for young people, suicide misuse prevention, recognizing the signs and symptoms of youth who may be experiencing a mental health crisis or challenge, and how people in the community, including families and educators, can refer a child for support and to be preventative. Also to be able to recognize the signs and symptoms of, or the signs of child abuse and neglect. And so we continue down that road even in this remote world. So we're still providing all kinds of technical assistance and training and resources to school districts so they can have the same kind of tools, because we know that risk factors during this remote time are more elevated for a variety of reasons. Obviously the stress and some of the trauma students may be experiencing, the fiscal impact on families, inability to access a lot of the same supports and services as they normally would. So we're still providing that. We're also convening virtual villages, so to speak, of educators, project managers, community providers, as they were still working together behind the scenes when the school walls were still up and the students were accessing. So we're trying to convene virtual village sessions where the providers and educators can learn from one another, because in New Hampshire, as you know, it's all local control. And so what we're seeing now, the silver lining, is each community has their own approach, and it's based on, all kinds of barriers, challenges, also, the types of resources and supports that communities have access to. And they're really coming together in a really beautiful way, almost like a tapestry of supports. It looks different across the entire state. Every community is sort of coming up with their own means of checking in with students and making sure that nobody is forgotten. So we have school districts who have support staff, including guidance counselors, student assistants, professionals, social workers riding the buses while they drop meals off, so they can have that eye on the student to be sure that they, because again, in a virtual world, like was mentioned earlier, there's only so much you can glean from how a student is doing in terms of wellness. And that's really our focus. You have to be well in order to be able to be successful academically. We also want to keep kids safe and to ensure families that the protective factors still exist, even in an environment like this. I've talked to several school districts to try to get an idea of how they are keeping track of the most vulnerable and at-risk students. And they have each come up with all kinds of can't say that word, systems to be able to track. So we've got school nurses doing telehealth and keeping track of the kind of contact that they're making with students. We've got guidance counselors doing the same. So really looking at obviously the universal supports, but the kiddos who need the tier 2 and tier 3 and who did in a school environment, the schools are finding really creative ways to continue to do that in this type of environment. And it's been pretty inspiring. And at the end of the day, I think it is the silver lining. And I hope that families come out of this with the recognition that their community is working really hard, whether the school doors are open or closed. This is the kind of stuff that was still happening when the school doors were closed. Now it's just amplified and much, much more challenging. Not sure if I answered your question completely. But
that was helpful as you were talking about, the efforts across the state to think about this in a creative way to still support students and families. I'm wondering if down the road, we'll probably still be in some version of this in the fall. maybe not, but I think schools are preparing for that. If there's a way for schools to share all these resources in one place or work together. I know in all professions, it's hard to put the work aside long enough to collaborate with colleagues, but I wonder if that's something that would be helpful to schools.
Yes, as a matter of fact, we have, through one of our newest grants called School Climate Transformation, one of our federal grants, we have 3 new regional consultants who each have a territory that align with the Department of Ed regions. So there are 5 Department of Ed regions, and we currently have 3 positions who are supporting the South Central, Southeast, and Southwest regions, and they're planning their convening of cohorts so one another can, we can provide the technical assistance and training, and then the cohorts can get together, whether it be virtual or in person when the summer comes, because as you know, we're already planning for back to school, but also we have, you know, a huge challenge in how we're supporting students over the summer because their typical programs are, it sounds like many of them have had to cancel. So there is a lot of work being done behind the scenes to be able to convene those. And we do have already from other grants and cohorts that we have operated for many years through some of our other federal grants, cohorts that operate in the same manner in the North Country and also in the Lakes region.
Oh, that's great to hear. We have some school folks on today who could benefit from that. And I should have said earlier, at the end of this, we will provide participants contact information for all of these agencies so you could follow up as needed. If we could turn to Ken, with Executive Director, NAMI New Hampshire, what have you been seeing in terms of needs from your client community? And are they different now? Or is there an increased need? Are the triggers for those needs different? And how are you responding in terms of your own service, but sharing resources?
Thanks. A lot of things are very similar to what everyone else has said. And I think one of the, one of the biggest things is we see both. We see, we do a lot of family peer support, so mutual support with families one-on-one, and we've done that using a variety of telehealth mechanisms, whether that's texting or phone or Zoom or other platforms. And clearly seeing that there are some individuals who have thrived and really shown some real resilience during this period of time, and maybe found some strengths that they didn't know that they had in families, but others who are struggling and struggling for a variety of reasons. One of our volunteers, I think, put it very well and said that we're all in the same storm, but we're in different boats. And I think that there's a lot of wisdom in that statement in terms of what each of us are dealing with and how we're coping with that. So one of the, I think we were pretty well positioned technology-wise, as other people mentioned, with devices and laptops, so that we immediately switched to all of our staff working remotely, which many of them already did anyway. As a statewide organization, many of them were not office-based, and so that worked pretty well. And we completed that pretty successfully the first week, and then the second week really worked on our volunteers and how do we, because a lot of the work that we do is volunteer-based, the educational programs and some of the training that we do, all of our support groups are volunteer-led. How do we make sure that they have the technology? And many of those support groups took place in hospitals, churches, and other locations where they were no longer accessible to folks. And so I think initially some people in the first couple of weeks were, well, we're going to wait and see. And when it was clear that this was going to be a long-term issue, then a few people stuck their toes in the water and started to offer support groups online. We have support groups for suicide loss survivors. We have support groups for adults with a loved one with another adult with a mental illness, or parents or caregivers of a child with a serious emotional issue. So we have different types of support groups that are available. And one of the things, I think the great things that we've seen is that where transportation or sometimes childcare or care for an adult who isn't doing well at home has prevented people from attending those groups. been removed now. And so we've seen people from where we, in some of the groups that we didn't have available in our North Country, they've been participating in some of those groups now statewide. And then likewise with our educational program. As a national organization, many of the programs that we do offer come from NAMI National, and while we don't have financial ties to them, they kind of dictate how and where and when we can use those programs, and many of them were not allowable up until this point to be done virtually. And so we've seen that convert a lot, and a lot of work in terms of colleagues across the country and help with NAMI National to convert those programs and support groups. As other people have mentioned, we've learned some of the challenges around Zoom and how to utilize that. For support groups, there's confidentiality concerns people have about who is in the room. And if I don't know you, I mean, if they didn't have a previous relationship, what are some of those boundaries? Some people don't like to show their face and during a Zoom session. And so, you know, some people have sort of worked out compromises where there might be a 10-minute welcome and people show their faces and they sort of do a brief intro, but then they can turn off their video if they want to do that. So we've gone ahead and really begun to offer a lot of those programs virtually, educational programs, webinars, some of our speakers bureaus. We right now have a series starting tonight for In Our Own Voice, which is people who have lived experience with mental illness telling their stories about their dark days and their recovery. And we have a few of them coming up. Tonight's Tom Grindley, Services Office of Consumer and Family Affairs. And then, you know, we've really tried to, particularly with our Connect Suicide Prevention program, trying to get that out there to people virtually, although we've certainly had some challenges with that. And that's a national program. And so we've been working with other states of rolling that up. But we've also tried to think creatively about how can we make sure that social distancing doesn't become social isolation. And so what types of things can we offer? So as we speak, there's a yoga class going on that's happening virtually. We've done bedtime stories. We've done movie nights, done some other virtual events. We have an online auction going on for a Day of Hope on Saturday that coincides with the NAMI National Day of Hope. So try to think about creatively about those things and how we can reach people that way. And then our information and resource line is available. That's 800-242-6264. It's not a crisis line, but it can help people find those supports around the state or mental health services around the state. And we've really collected a lot of info from our of various what's happening in different organizations relative to COVID and posted them on our website. And, you know, and I think the good news is that there is just a wide variety of programs available. The peer support agencies around the state, there are 10 of them. They've really stepped up, offered a lot of services virtually, support groups, warm lines, different types of programming. And so that's been really great. I think a great resource as well. And then we've also continued our advocacy efforts. Advocacy is the third leg of the stool that we work off of. And we've been continuing to work on emergency department boarding and monitoring that situation, on due process hearings for people in emergency department boarding, and most recently on crisis standards of care. The governor issued as part of his executive order number 33 and has some very specific information about mental health and behavioral health. And we have some concerns about that. I'm participating on the state Disaster Medical Advisory Committee, and we formed a group of folks looking at those standards of care. So also doing, you know, working nationally with our congressional delegation to really make sure that we don't drop the ball on mental health during this crisis. And we know now more than ever that, you know, that people need support. And that's across the spectrum. It's the general population, it's people with mental illness themselves, and it's our frontline providers who I think we originally thought were law enforcement and first responders and intensive care and emergency department staff. And we now realize they're long-term care facility staff, other residential programs, and even our frontline workers in grocery stores and others who are, experiencing tremendous stress and anxiety just going to their jobs every day. So that's a lot of what NAMI's been doing.
That's good. The creativity again is wonderful, and I could see opportunities to continue this as even when we are back in each other's presence. I just wanted to share a resource that came in. There is a substance use disorder virtual group as well. Someone shared this, another virtual support group, and that is available through Granite Pathways. You can find out more at granitepathwaysnh.org. So thanks for that resource. I'm going to get to a couple more panelists, and then maybe we'll try to turn to some audience questions. Dennis Walker, are you there? Can't see you, but I'm sure you're here. You are, you're in the emergency services business. You're really on another kind of front line. Could you tell us what you're seeing, how that's, and I'm thinking, mental health. I know you have the health part to consider, symptoms of COVID, but in addition to that, I'm sure there's some mental health uptick in those kind of needs. What are you seeing there, and how are you responding?
Yeah, that's a good question, Anne Marie. I think the thing that I think about right away when you're in the emergency department, and we're embedded with over at Exeter Hospital, is you see the bravery of the doctors and the nurses and the healthcare professionals, and the unquestioned dedication and bravery. And then, right along with those folks are the mental health clinicians who are embedded in the ED. And I couldn't be more proud than all my emergency services colleagues around the state who are doing great work on the front lines, helping people who are in crisis. So you can't help but be inspired. Every day I'm inspired by my staff who are on the front lines. And, we really didn't know how folks were going to react. People are human. And so, we didn't know if people were going to start calling in or, of course, getting sick, things like that. And the dedication that I've seen from my staff, I'm able to connect around the state to all the other directors. The dedication that these folks have exhibited since COVID has just been absolutely remarkable. They deserve a ton of credit. I would say, just to talk a little bit about on the tech side of things, which has been, this whole situation was thrust upon us, and we typically see people in person. So when you think about how this impacted on emergency services, you really have to consider this is a whole new thing for us. I mean, we've never done anything on the telehealth side of things. People are either knocking at our door at the agency, or they're coming over to the hospital to see us. And so, in some respects, we saw where it didn't work, but on the other side of it, we saw the successes. And I'll just tell you about a couple of them. We had a gentleman who came in probably about a month ago, and we connected with him from our office inside the hospital. We gave him a tablet, and we did a telehealth assessment from our office into the emergency department for this particular one. And one of the things he kind of indicated to us was he was able to type in some of his responses on the tablet. Of course, the tablet had a mic and video, but he told us that this was the first time that he was just able to get everything out and talk about it by keying it into the tablet. And it just all stopped us in our tracks and making us realize that some of this equipment can just open people up in ways that we never thought. And so that was really exciting that he was able to talk about things that allowed us to, write an appropriate assessment and get him the services that he needed. What we also did was we had a family that called us about 10 or 11-year-old who needed to be admitted, was on the autism spectrum, to a hospital, psychiatric hospital. He's on the autism spectrum, but traditionally when he would come in to the emergency department, he would get very upset, as you can imagine, with the noises and having to tell the story to three different, his story to three different people, and all the stimulation that you can get in the ED. And we were able to actually have a telehealth appointment with him from our office to his house, and then work with Hampstead Hospital and connect them together so that he didn't have to come into the hospital. So just imagine, from the COVID perspective, a lot less risk of exposure, but just from a stimulation perspective, not having to come in and tell your story to so many people. And oftentimes we know that the emergency department is not the best place for people. So the technology in COVID has really kind of helped us solidify that if we can offer people different options, oftentimes we can prevent them from having to come into the ED where, again, they have to tell their stories. And coming to the ED is often not the most appropriate place when you consider, that you have to take all sorts of tests, blood work and things like that. You obviously have to tell your story. It can be very stimulating, and we just know that a lot of people don't really need to do that. But that reflex is still out there, right? That people have to come into the ED when a lot of times they don't have to. And of course, this technology is a light's been turned on for us that we can even do more through it.
Right. I think you mentioned the heroes of the healthcare world. I think in the way remote learning has increased an appreciation for teachers at the moment. The same is true for mental health and healthcare workers. If I can just ask you a quick follow-up, how are you caring for your caregivers? What is available to your employees? How are you checking in on their stress levels, their mental health?
What I try to do is I try to go in every day and look into their eyes and see how they're doing. And there's a lot of talking going on, a lot of discussion about just how you're doing. We know that our staff has, it's not only the strain of coming in and the fear of exposure, but we also know they're human, they have families. Oftentimes their families know that they're coming in and out of the ED, and it's kind of like they get nervous about them coming over. So, it's not only the kind of the stress of the work, but it's about how COVID has impacted on every other aspect of their life. So we I try to spend a lot of time just talking to them about every single day about what's happening. Try to be in there myself, helping out with the clinical load as well.
It's sort of like a new version of peer support, I'm guessing, because everyone's in the same situation. If I could turn to Jessica, you're the director of the Mobile Crisis Unit. Your work takes you to people in their settings. Could you talk a little bit about what a day might be like prior to COVID, and now how you're handling the challenges around social distancing?
Sure. I want to start by saying, Dennis, I think you gave a great plug for Mobile Crisis and talking about people being out of the emergency room. So thank you. Great segue. I think from the perspective of Mobile Crisis, I think we've been incredibly lucky in Manchester to have been operating our Mobile Crisis team for about 4 years now. So this is really, we've always had the mission of really seeing people in crisis where they're at, trying to help people understand that they don't have to walk into an emergency room. In many cases, they don't need hospitalization. And by accessing community supports and really looking at the strength of the community and figuring things out in the moment at home or wherever the person is, they don't necessarily have to go. So this pre-pandemic, I think it's something that we've always sort of worked toward, and it's helped to prepare us in this sort of era, but it's also added some incredible challenges to our team. I think, we're a team that is used to jumping and going out into the community. We respond, we get a call 24/7. We have a team of people who go out and go everywhere in the Manchester area to respond, and within 15 minutes or so we're there on scene. We've had to really make sure that we continue on that service and let people know we are still here, that there is an additional risk in going to the emergency room and hospitalization, as Dennis spoke to in this time of COVID. And so being able to continue to do that, making sure people know that we're here. I think one of the things for me when we started kind of feeling the effects of this is seeing our numbers initially go way down. And it was a little surprising. I think we were all kind of bracing like, oh my gosh, we are going to be so busy. People are going to be, calling us and needing all the support. And the phones for a little bit were pretty quiet. And that was concerning in a way that, you want to think that, okay, great, people are rallying and they're, using their natural supports and they're doing great. And at the same time, the resource is drying up. So things that people may have utilized are no longer open, or they may no longer have the immediate access to something. So we really had to think about, how do we let people know we are still here? Are people socially isolating to a point where they're not accessing the supports that they need? So we really had to think about, how do we get the word out there? So really trying to utilize social media, utilize the news, utilize our community partners to make sure people know we're here. It's business as usual. We have safety precautions in place, of course, and things that we're doing to stay safe, but we can still provide the same level of support and service to our community. And that has worked really well for us. And I think some of the things that we've had to do is make sure that we're doing the proper screening, that when we do get a call, we're asking the right questions, we're staying up to date. It's been an ever-changing environment with the CDC and what the guidelines have been, and just thinking 8 weeks ago where we were and what the guidelines were, it's, we were at a point in our agency where we had daily COVID huddles. I think we all kind of know that term now, the COVID huddle, where we, review the latest information, review the latest PPE protocols, make sure that we're doing all of the things that we need to do to stay safe and keep our community safe. Things like having extra masks in our backpacks so that when we go out to see people, the first thing we're doing is offering those masks, offering hand sanitizer, making sure that we are social distancing when we are going out to a site. We have, and from a mobile crisis perspective, pre-COVID, it's been interesting that we've had a 95% diversion rate from the hospital, which has been an incredible thing. And that just speaks to the great work of our clinicians and our peer support folks who are really helping to keep people out of the emergency room. This has actually increased since COVID, which is a great on all levels. So we're at about a 96% diversion rate now. In the past 8 weeks, we have seen close to, we've provided, I can't even tell you how many services, over 3,000 services just on our team to the Manchester community. And we've seen over 600 unique individuals, kids through seniors. So our work continues. We just do it a little bit differently. I think, Erin, you had said that IT has been sort of the unsung heroes. They've been incredible. And so we have been able to utilize some telehealth for folks who are at lower risk in terms of suicidality and crisis, to be able to reach them in their homes, particularly folks who may be experiencing some more at-risk medical symptoms. So we've had that option, which has been incredible. And it's also allowed us to do some pre-crisis and post-crisis work with people that we have had contact with, to really help them along as they are kind of navigating this sort of new way to access resources.
Thank you. So even with the phone sort of quiet initially, certainly still seeing a huge number of people in need and services. And that's great to hear about the diversion from the hospitals, how, even in this time of crisis, all of you can still work together to get people to the best service that could help them right now. If you wouldn't mind, I wanted to turn to some questions from the audience, and bear with me, I'm going to try to get through these. So we have one, maybe someone from the Community Mental Health Center could respond to this one. There's a shortage of psychiatric providers in New Hampshire. Has this, I know that's always a challenge, has COVID increased that challenge for someone? So maybe could I have someone from a Community Mental Health Center take that question?
I mean, I think, again, Anne-Marie, in a telehealth world, that's actually probably decreased some of the access. I know here at Seacoast Mental Health Center, all of our prescribers, our psychiatrists and our nurse practitioners have been using telehealth platforms to continue to not only meet with our current patients and manage and follow their medication, but they've been doing new intakes for patients who would be new to our psychiatry department. So I think, and I saw a head shake, most, if not all of our centers have really explored the idea of how we'll continue to use telehealth moving forward. We already know that licensed practitioners have had the ability to use telehealth and can continue to do so. And our state representatives are working to make sure that that continues to stay in place for our non-licensed staff. So it's really created, I think, a whole new world to decrease those barriers and increase the access to care, not only when there's limited psychiatric providers, especially child psychiatrists, but also when we start to think about folks in our more rural areas of all of our catchment regions. Even in the Seacoast, we have populations out west in our catchment region that is really difficult for families to get in, for our adult patients to get in. So I think this just broadens the horizons of how we offer care.
Do you think the move to this telehealth and the new creativity and sort of the attention that has come on the value of mental health care, can that be a recruiting tool at all to bring new people into the field? It's certainly such a celebrated field. Finally, I think there's an increased awareness on that it is a frontline critical need. So is there an opportunity there to bring in more new providers?
Absolutely. I mean, I think we have a lot of colleagues who began their careers in community mental health and made decisions to go to other small practices or develop their own private practices. And I think if they're looking to diversify their work experience a little bit, all of our centers would welcome those employees back to not only continue their private practices, maybe where they're primarily serving adults, but could come back to one of our centers on a part-time basis, even full-time basis, to work with a child and family population. We have a lot of folks like yourself who have guidance backgrounds, but have the right credentials where they could be doing some work at the community mental health centers as well. So I think it just creates a lot of new opportunities, especially for a workforce perspective, where we've struggled with the behavioral health workforce within our state. It's been a hard field sometimes to attract new employees to or new students to. So I think we just hopefully created a new dynamic for a whole new population of employees in this area of work.
Thank you. We've had a few questions around technology, and we've talked a lot about what's worked well. And there's got to be some challenges as well. Are there platforms or Zoom or others that you have found that have been really helpful, and have you experimented with any? And I'll throw that question out to anyone on the panel.
Well, we use Zoom primarily. We use paid accounts. That is a crucial aspect of using Zoom, because it is only the paid accounts that are HIPAA compliant. And then, of course, making sure that we are password protecting everything, creating unique identification for each meeting we have, to try to decrease the odds that somebody will just pop in unexpectedly. But I will say Zoom has proven to be helpful in ways that we didn't entirely expect. We certainly thought it would be great for video conferencing, being able to see our clients, but the screen share to share documents, using the whiteboard as a tool to kind of communicate, or even I know with some of our child providers, using that as a means to play games with the children and families that they're working with. We have some clients who are very uncomfortable using video and phone, but the chat feature in Zoom has been really helpful, which is certainly not something I expected, but that's been a real benefit as well.
Thank you.
I know in the crisis world, we've used DoxyMe, and one of the kind of unique features of that is when we're doing an assessment, we have the ability to bring in So if there's a child, for example, a teenager maybe we're speaking with, they can then bring in their parent. They send them a link, they click on the link, and then they're in. And so we've had these kind of unique ways to kind of bring people in, or a peer, for example. If we are talking with someone and they'd like to speak with a peer with lived experience, we can really immediately kind of bring them right in. So it's things that you don't think about. You think that, oh gosh, telehealth, we're not gonna be able to do half of the things we do in person, but once you learn to use the technology, it's pretty incredible.
I could speak to Doxy Meet as well. That's what I'm using for my appointments. It feels very safe and secure to me, and it's so smooth and it's seamless, really. So I've also really appreciated that. If we could turn a moment to funding, there's lots of money coming out right now to help everyone working on this issue. Where do you see state funding going? Are there concerns as we move into a budget year? Advice on how our community partners in this work can advocate for support, continued and perhaps increased support?
I can certainly start to answer that question. I'm sure Ken can also piggyback some. I think there's a lot of concern. So we have to begin with, will we even be allowed to continue to provide services through telehealth and the right? To Erin's point, a lot of our folks don't have access to the video capabilities, and so we are using the telephone. And so will CMS continue that, or will they revert back to prior policies? I mean, even our Medicaid policy here in New Hampshire was disequal, right? So folks that have private insurance have been able to do telehealth through video for quite some time, but Medicaid required the client to be in an office rather than in their home, right? So we need the regulations to change in order to continue to be paid for our services. So that's one area of advocacy that's needed, is simply telehealth to continue. Another concern that I have is related to some of the things that were started in relation to the 10-year plan. And so we are starting to make some movement toward, plans for children's mobile crisis and statewide mobile crisis. And we were expecting another Medicaid rate increase. But with the state needing to respond to this pandemic, are some of those things that were promised but not yet in place? Will the funding for those still be there? So I think there's no better time than right now to continue to advocate for those regulation changes for CMS in order to mitigate the potential negative financial impact that this will have.
And what should that advocacy look like? Is that calling your state senator, your state rep, reaching out to the governor's office, or Department of Health and Human Services? All of those, some of those.
All of the above. Certainly, Ken, do you want to talk about that?
Sure. I think Cynthia gave a great response with that. I think, first of all, yes, things are very worrisome. I think have to acknowledge that when we're looking at state budget, whether it's New Hampshire or any state right now, it's cause for concern. On the plus side, we have had tremendous support from the governor, bipartisan support in the legislature for mental health, and as Cynthia mentioned, the 10-year plan. And a lot of things were passed during the last session, like mobile crisis for children, that we really need to move ahead with those plans and keep those things moving forward. Likewise with suicide prevention. And while it's hard to tell what will happen relative to some of the rules on telehealth, I think it's fair to say we're not going back. They may not be as broad as they are now, but there's no way we're going back to where we were before. And I think that the insurance companies are aware of that as well. I mean, I think that there's general support across the board for that. How that happens remains to be seen. I think also important to note that that our Department of Health and Human Services, while they're behind the scenes, has worked incredibly hard to support all of us in making these changes and advocating for rule changes and making sure that we have the tools and the ability to provide services in the way that we can. And there's been some federal money that's become available. There was an emergency COVID grant for mental health, which the state successfully applied for through the Substance Abuse and Mental Health Services Administration, and that went towards funding emergency services. Also a grant last week around COVID and suicide prevention. So I think some of these things, for me, the short answer is we already have the plan. The plan is the 10-year plan, and all of those key parts of the 10-year plan are what's important in moving forward, whether it's peer support, mobile crisis, early childhood, step up, step down services, clubhouses, all of those things are so important. And we need to really focus on that 10-year plan. One other thing that I would mention too is that, didn't get a lot of attention, but in January, the New Hampshire Insurance Department completed an 18-month look at what they call a market conduct analysis, looking at approvals and denials of insurance claims. And what they found was something that we've known all along, which is that claims are not being paid at the same rate as they are being paid for medical surgical for mental health. And so we really need to work to even up that equation and make sure that mental health is funded at an appropriate level, because those claims trickle down across the board and impact on reimbursement rates, which impact on workforce shortages, which impact on people deciding whether they want to be in these careers or not. So yes, much advocacy still to be done.
Mm-hmm. And maybe you could help with this, Ken, or any of the other panelists. Have there been any promises, prior to COVID disrupting everything, of not touching some promised money, whether it was for an increase in rates or the mobile crisis money, or going ahead with the children's mobile crisis unit, putting out an RFP on that? So were there promises made that you still feel will be honored, or are you worried about those as well?
I mean, I do think that DHHS and the governor, right, they really are working to support the things that were proposed in the 10-year plan. I mean, we've heard that there won't be a taking from the funds that were set for the children's mobile crisis, yet COVID has really delayed the RFP coming out. And so it leaves us weary, even though we are certainly hearing and seeing some of the support, because when push comes to shove and there isn't money, if the federal money stops flowing into our state or we're not able to get it, what happens then? And that's why we can't stop advocating, because we need to say we still need this, right? COVID has not changed our need for statewide mobile crisis. It has not changed our need for children's mobile crisis. In fact, it's increased our need, if anything.
Mm-hmm.
And I think maybe to add to that, if anything, this is a time where how telehealth and these platforms have been utilized, how it may even add to and enhance mobile crisis practices. So I think when, it's right now, we have to really focus on how we continue to deliver care safely from our staff to the patients within the state of New Hampshire. And I think it's an opportunity for a look at every service that the community mental health centers are providing, that private practitioners and group practices are providing, in conjunction with partnering with our state agencies, and how we can continue to do that and expand upon it while utilizing these platforms. Because I think that's one of the biggest successes out of all this. As Ken said, we're not going backwards. We're going to continue to move forward with using telehealth, and it probably will only enhance those RFPs that were out there and will come out in the future for other services.
Mm-hmm. In terms of advocacy, just so we've had so many questions about this, what's the best approach? We talked about, you calling a lawmaker or state official. To the degree clients are comfortable and have been informed and there's informed consent, are those client experiences helpful to share? Are those compelling with our lawmakers? And how do you go about this? If it is valuable, you don't want to encourage someone along because of your own self-interest without thinking about theirs. So how do you balance that? How do you approach that?
That's a great question, and I'll start with it, and others can jump in, but I think it's the most powerful thing. I mean, it's those personal stories that are what influence people more than anything and change attitudes and educate. I think that people lose sight of, because we kind of take it for granted, or take it for granted, so to speak, what access we have to our legislators in the state that is just unique to other places in the country. I mean, my colleagues at NAMI around the country, I've had people say to me, you get to testify in front of the legislature? And I say, how many times a week or how many times a day? And any citizen can, come. Every bill has, if it's going through, has at least a hearing in the House and the Senate that anybody is welcome to testify to. We have unprecedented access. In other places, they say, oh, well, we have to be invited, and we get invited to the subcommittee, not to the actual committee. Our congressional delegation is phenomenal as well. I mean,
I think we may have lost Ken.
Okay, I didn't know if it was just on my end.
It's not.
Thank you, Ken. We don't have a lot of time left, and I want to give everyone a chance to jump in on this. In terms of going forward, are there 2 or 3 things that you think have been the most helpful that you maybe didn't expect or didn't expect to be so successful? Whether that's the chat feature or the riding Disney rides together. What things do you think have been so helpful that you really want to keep in place? And maybe I'll start with you, Dennis. I love the example of the emergency room visit where someone, it's so emotional that someone could express themselves, because this COVID crisis created that opportunity.
Right. Yeah, I think
hold on to that.
I think the thing that is exciting, and we didn't want this pandemic, but part of what's really exciting is that everybody is now talking about mental health, right? So I think, for example, you can't talk about a lack of PPE without talking about the mental health repercussions, or you can't talk about the folks we've lost without talking about grief. You can't talk about unemployment without talking about anxiety and depression. And so it's a whole new world with, I think we've generally in the country had this dichotomy between mental and physical health. But now what we really have to come to understand is it's all together, right? We can't separate the two. And I think one of the things that COVID has brought us is, really all of us, is this understanding of mental health. I think we've all experienced anxiety, right, going through this. I mean, what's going to happen? Our family members, are they going to be okay? Our staffs, the people that we know who have a pre-existing illness. So we all get a flavor now of what anxiety is all about. And this is, I think, something that is going to benefit us as a community to start really talking about mental health more and understanding that there's really we can't have a distinction between the physical and the mental health.
Right, something we've been saying forever, but now it's become an experience for everyone. I'm just going to move around the table, virtual table here. Aaron, what are some things, maybe 2 or 3 things that you've experienced? And you mentioned the chat feature, but are there others that you just thought, wow, we have to hold on to these things?
Well, I think I'm with Ken. I'm an optimist. I like to think that telehealth is going to stay, but I hope that it remains expanded to the people who are allowed to use it, as well as telephonic use. I think unless it includes the telephone, we are going to lose a large opportunity to serve a lot of clients who do not have access to technology. And I think that that's been invaluable. One of the things that has been very interesting is we've had some clients make tremendous progress in the course of their therapy right now. And it finally kind of dawned on me, one of the biggest contributing factors to that is they're no longer relying on transportation to get them to an office to have their appointment, that they can have this appointment and they can continue that therapy and make that progress regardless of that transportation availability. And so if there's one thing that we can hang on to, I truly hope it's the ability to provide telehealth to our clients.
Thank you. Michelle, in thinking about the schools, I just remember even with a caseload of 200 kids, which was tiny compared to a lot of my colleagues when I was a school counselor, couldn't get to, a fraction of them some days. And I'm wondering about, is there an opportunity to bring this into schools in a way that is safe and secure, whether those group or individual counseling? Is that something that you think would be helpful or there's talk about?
So if I understand your question correctly, a huge piece of our work in the framework that we promote, multi-tiered system of support for behavioral health and wellness, includes collaboration with community mental health centers and other providers for both school-based and community-based types of services, with the resources and energy focused on removing barriers to access. So this is actually not new, and we have school districts across the whole state who have really come a long way with this and continue to move forward. And like I said, every school community is very, very different and works very differently with all of the resources and community mental health centers. And then the state agency is working with the community mental health centers, DHHS and other partners to really, and it's under the System of Care Law 135F, to be able to create a seamless integrated service delivery network where the schools are just as involved, and that collaboration is allowing for that to happen, and whatever works best for the community and what works best for the family. So it's not new. There's a lot more growth to happen with that, but there's a lot of momentum in terms of getting to a place where it's consistent across the state and works for the local community.
Thank you. Jessica, what are one or two things that you would really hope to hold on to in your work?
So from a little bit of a different perspective, sort of the boots on the ground, we've had something happen in our community that has become a challenge and a success. And so one of the things that we have learned is how fragile some of our systems are for our most vulnerable people. And so through this experience with the pandemic, we've had an enormous increase in the amount of homeless people in our city who have been displaced because of resources closing and sort of that isolation that happened. So one of the things that has come of this that I hope to continue is we have, as a community, really come together and started talking with each other, community agencies, police, fire. Our mayor is out today in the homeless camps, basically forming a partnership and going out. So the mental health center here has gone out every day for the past, I think, month at this point, to the homeless camps. We've reached out to about 150 people in 25 different homeless camps around the city, and really bringing the resource to them, providing mobile crisis supports, but also really just helping people to realize that there are still services in place. They're a little more challenging to access right now, but they are there. And so we've had sort of an incredible coming together of our community partners for this crisis. And I hope that it continues post pandemic, because really what it does is highlight the need for us to work together.
If I could move to Cynthia, something you really don't want to part with when we are through this.
Well, I was going to say collaboration for sure, because I think, where I began saying initially about our teamwork and how that really helped our team to push through this, I think that's even broader, right? So it's been our community and our local FQHC and our peer support, mental health and SUD services centers here, our local FQHC. There's been a lot of collaboration and working together, and even among our community mental health centers, right? I mean, we compared notes as we started, what were the different agencies doing so that, and we helped one another. And we're doing the same thing in terms of the back to the office planning. A lot of us as the community mental health centers are talking with one another. What are you doing? And what are you doing? And sharing ideas. So I hope that we can continue to collaborate and leave that space for sharing of innovation and things. The other thing that I was going to say, because in some ways it's more than just advocating for telehealth. The reason why we want to advocate for the telehealth is because we want to improve access. And the only way to improve access is to individualize that access. So some people need to be able to walk into our center the day they need that help. And so that's why at Greater Nashua, we have like a walk-in intake assessment team. So when you're ready, we're ready. You just walk in. Other people need to call and set an appointment to work up to it. They need to prep themselves up to it. Other people need the telephone. Other people need the video. And so I think one of the best things that's kind of come out of this is an ability for us to meet people where they're at, to really garner the client's feedback, the lived experience of what's happening. And so, you know, what's needed for some of these changes to endure is to hear that feedback from our clients, to really listen to what they're saying has worked and what they're saying hasn't worked in our traditional system of access. And so now we can really have the opportunity to redefine what access is and make it individualized for each and every person.
Right, clients are the expert on the client, and
absolutely
we get ahead of that because we're busy and it's just easier to think, you know, in a room of experts we know, but thank you for that. Jody, could you share something that you would like to really hold on to?
Absolutely. I mean, I think everybody has really spoken very well about those same things. I think that telehealth has become a real game changer when I think about the opportunities that we've been able to have with children and their families. For those families that are separated or divorced or maybe have wanted to really work on their co-parenting relationship, using telehealth has been a safer, I think, more comfortable practice for a lot of our co-parenting families. And so just the idea of the access to care, families who have children with multiple schedules and different places to be at one time, using telehealth has made them more available for appointments than they ever felt like they could before. And when I think about kind of just as a human experience, I really hope that we don't lose sight of the strength that we've all had during this time. I think that in my conversations with not only colleagues here at the center or across the state, friends, and then the families that I'm working with, this idea of how the pandemic and the social distancing has slowed us down and helped us reprioritize what's important in life. And it's hard that, you know, a world crisis kind of puts us in that perspective, but I really hope we continue to walk away with this idea of hope and really prioritizing those things that are most important, which is loved ones and just trusted colleagues and really just the value that each of us have.
I've heard so many people say the slower pace has been so wonderful and replenishing for them. So I hear you. We have a couple minutes left. I want to get to Ken, and then we will share a resource page with all of you for contact information and follow up as needed. So Ken, what would you hold on to?
I think I mean, I would just say ditto to what everybody else has said. I mean, it's just, you know, there are so many key points here. And I think that while certainly there have been significant challenges, we've moved ahead in ways that we never thought were imaginable before. And I don't think that we're going to go back relative to telehealth and to really, you know, I think as Jody said, to meeting people where they're at and giving them options that haven't necessarily been available. I, you know, also want to just highlight one of the things that Dennis said, which is just the breakthrough in having somebody that needed to be hospitalized, having that happen without them going to the emergency room. And I think for me, that's part of what I hold on to hope for the future with as we move toward statewide mobile crisis. Is at a federal level, we work on a national suicide prevention lifeline or mental health lifeline, 3-digit 988 that families and individuals have something other than 911 or the emergency room to call for help when they're experiencing a mental health crisis. So those are a couple of the things for me.
Thank you. Well, we're just about out of time. I want to thank all of you. I've been so grateful for your time and your input. I'm sure that our attendees have found it helpful. I'm guessing you may hear from some of them with follow-up questions, and I'm sorry we didn't get to all the questions. So I think now I will turn it over to the folks running the screen here and ask them to put up the resource page. Great. There's that. We'll leave that up. Whoop, is it still there? I can't see it, but I'm hoping, can someone shake their head? Is it still there?
No.
No.
Ah, there it is. Okay, so that's there. We'll leave it up for a couple minutes. I want to thank all of you again here on the panel and in our audience, and have a great rest of your day.
Thank you.
Thank you.
Thank you.